Hello, hello, everybody. We are just going to give a couple more minutes while people trickle in, but we want to thank you so much for attending the Healthcare Matters webinar as part of Congresswoman Adams' Charlotte Matters webinar series. So just give us 1 or 2 more minutes and then we'll begin. All right, we can go ahead and get started while people still trickle in. Hello, hello, everybody, and thank you so much for joining us today for Healthcare Matters, part of Congresswoman Adams' Charlotte Matters webinar series. I'm Caleb Harmon, and I have the pleasure of serving as the Communications Director for Congresswoman Alma Adams, and I will also be your MC for this night's webinar. In today's Healthcare Matter webinar, we will go over the government shutdown, the expiring Affordable Care Act premium tax credits, and other federal cuts that are impacting healthcare in our community. We are proud to be joined today by a panel of healthcare experts who will share updates with us, as well as hear from Congresswoman Adams in just a few moments. Towards the end of the webinar, we will also hold a Q&A session where panelists will answer your questions on healthcare policy. And you can submit those questions for the Q&A using the Q&A box at the bottom of your screen. Now, I have the pleasure of introducing Congresswoman Alma Adams to begin our webinar. Congresswoman Adams represents North Carolina's 12th Congressional District in Congress. She is co-founder and co-chair of the Congressional Black Maternal Health Caucus, as well as founder and co-chair of the bipartisan, bicameral Congressional Historically Black Colleges and Universities Caucus. Congresswoman Adams, I turn it over to you.
Okay, and good afternoon, everyone. Good evening. Thank you for joining us. I am Congresswoman Alma Adams, and I have the honor of representing the 12th Congressional District here in North Carolina, Mecklenburg, Charlotte-Mecklenburg. Thank you for joining us for Healthcare Matters. Indeed, it does. This webinar is extremely important, especially in view of the fact that we're going through a crisis right now, and healthcare is a big part of it. So this is part of my Charlotte Matters webinar series. Your health and health of our entire community truly does matter. And I'm glad that we're taking the time to be a part of this conversation. And so I'm grateful to be joined today by an outstanding group of healthcare professionals and advocates from right here in our community. And I want to thank them for taking the time to join us. Dr. Doug Robinson, retired physician in Charlotte, focusing on diabetes and metabolism endocrinology, and chair of the Healthcare Justice, North Carolina. Thank you, Dr. Robinson, for being here. Dr. Charlene Green, a board certified anesthesiologist from Greensboro. She was my personal anesthesiologist, former president of Old North State Medical Society. Dr. Green, thank you. And Dr. Edana Holliday, a doctor of pharmacy and CPHQ with C.W. Williams Community Health Center in Charlotte. We've done a lot of work with C.W. Williams, and thank you, Dr. Holliday, for being here today. And then Mr. Nick Wharton, President and Chief Executive Officer of the Charlotte Area Fund, a leader in combating poverty in our community. Thank you so much, Mr. Wharton, for being here as well. You're going to hear from each of them shortly as we explore the challenges and the opportunities facing healthcare in our state. Healthcare is one of my 4 H's alongside hunger, housing, and higher education. And that's why I've launched this webinar series to highlight how the ongoing government shutdown is affecting each of these essential issues in the 12th Congressional District. I spent the afternoon at the Novant Health Center, the Presbyterian Hospital, talking to some of the healthcare workers there. For me, healthcare isn't just policy, it's deeply personal. I was raised by my mom, a domestic worker who cleaned homes to support my sister, my brother, and I. She worked long, hard days, often pushed through her own pain because she wanted to build a better life for us. And so, even though she worked full time, she couldn't afford health insurance, and there wasn't health insurance available for people who did that work. There was no Medicaid expansion or no Affordable Care Act to help families like ours at the time. I lived, my sister, who was a couple of years older than I, lived with sickle cell anemia, which was painful and often an unpredictable condition. I think it's much better today as people are living longer. I can still remember countless hours that we spent in the emergency room watching her endure excruciating pain, while my mother worried about how we were going to afford her care. And I wonder just how different things might have been if Linda was able to receive the care she needed, and if mom would not have had to sacrifice so much just to keep our family afloat. I often wonder how different things might have been if we had access to affordable, comprehensive health care. I remember Dr. Martin Luther King's speech a long time ago when he said, of all of the forms of inequality, injustice in healthcare is the most shocking and most inhumane. He was right then, and he's right now, because healthcare should not be a privilege. It should be a fundamental right. But today, that right is under attack. This year, we've seen unprecedented efforts to undermine affordable health care, and the current government shutdown is a direct result of that. Republicans in Congress have refused to work with Democrats on a bipartisan bill that would extend the Affordable Care Act enhanced premium tax credits, which is a life-saving program that helps over 22 million Americans, including 880,000 right here in North Carolina, afford health insurance through the ACA marketplace. And so if Congress fails to act and those credits expire, think about it. A family of four in my district earning $64,000 a year would see their premiums rise by more than $2,500 a year for the exact same plan. Well, that's simply unaffordable. And waiting until next year, the end of the year, to address the expiring tax credits will be too late because open enrollment starts November 1st. That's next week. And that's why Democrats are fighting to extend these credits now. Insurance companies have already begun notifying families of steep premium hikes. And make no mistake about it, this will affect everyone, not just those individuals receiving assistance. Because if the credits expire, 157,000 North Carolinians will no longer be able to afford their health insurance, and they will become uninsured. So when people lose their health insurance, hospitals and clinics are forced to absorb those costs, which are then passed down to other patients like you and I. And so this cycle puts a strain on our entire healthcare system, forcing clinics to close, providers to leave, and services to disappear, especially in rural and underserved areas. So the tax credits aren't the only issue, because in July, Republicans passed their so-called one big ugly bill. They called it beautiful. There's nothing beautiful about it. It cuts nearly $1 trillion from Medicaid. And so those cuts will cost North Carolina's state budget and hospitals an estimated $32 billion over the next decade. And so to make up for that loss, the state has reduced Medicaid provider payments, cuts that took effect on October 1st. Primary and specialty care providers will now face 8 to 10% payment cuts from Medicaid. Home health and ambulance services are down 3%. Hospitals, nursing homes, and hospice care programs have been slashed 10%. And so even before these reductions, providers were struggling with low reimbursement rates from Medicaid and rising costs. And many will now be forced to stop accepting Medicaid patients because they simply can't afford to keep their doors open. These cuts will hurt our rural and low-income communities hardest. And I remember a time before Medicaid existed, and let me tell you, we cannot go back there. As your representative, I'm going to continue to fight every single day for your right to quality, affordable health care, because what matters to you matters to me. And health care, it's not negotiable. Working families should not have to pay the price for Washington's dysfunction. And so, as we continue navigating the shutdown's effects, please know that my office is here to support you. If you're struggling to reach a federal agency, uh, getting access to benefits, or if you need assistance with shutdown related issues, my staff stands ready to help. You can reach my Charlotte office by calling 704-344-9950, or my DC office 202-225-1510. Now I am delighted to turn things over to our panel of experts who will share their perspectives on how the shutdown and healthcare cuts are impacting patients and providers across our community. And we'll try to answer your questions about what comes next. Thank you. Back to you, Caleb.
Thank you, Congresswoman, and thank you so much for being a leader on this issue. Next up, we have Dr. Doug Robinson. Dr. Robinson is a retired physician in Charlotte, focusing on diabetes and metabolic endocrinology with 27 years of medical experience and serves as chair of Healthcare Justice North Carolina. Dr. Robinson?
Well, thank you. And thank you, Dr. Adams. I'm so glad to be here tonight. I just want to talk for a minute about what would seem obvious to all of us on this webinar tonight, and that's the connection of health insurance to health. Now, to be clear, insurance doesn't guarantee good health, but having it is a critical factor in accessing health care, including medication and mental health care. It's tied to better health outcomes, lower mortality rates, financial security, economic mobility. And as Dr. Adams said, it lowers uncompensated care for hospitals and improves hospital budgets, especially in those rural hospitals. So it really has me scratching my head when an administration that prioritizes making America healthy again wants to take away health insurance from about 7.5 million Medicaid recipients and a bit more than 4 million people who depend on ACA tax credits to afford their marketplace insurance. Many of these folks are our neighbors. I'm going to talk a little bit about the Medicaid cuts first that were part of the One Big Beautiful Bill Act. The people who are going to lose Medicaid coverage because of the bill are the beneficiaries of expanded access to Medicaid. So all but 10 states have expanded Medicaid as an optional state program under the Affordable Care Act. And North Carolina expanded Medicaid access in 2023. I was a small part of working on that expansion, and it really filled a big gap in people's health care access for those who made too little income to qualify for ACA subsidies. Remember, ACA insurance can be costly, so we need those subsidies to afford it, but they couldn't meet the strict Medicaid eligibility requirements. And Medicaid expansion really transformed the health of about 650,000 people in North Carolina. Now, I know this firsthand because I volunteer at a rural free clinic. We're not a federally qualified health center. We have fewer resources than they do. And we can provide care, but it's far from comprehensive. Our drug formulary is limited. We can often diagnose things that we can't treat and we can't refer to a specialist. So it is a form of care, but by no means comprehensive. Listen, when a number of my patients got Medicaid in 2023 and 2024, that was one happy day in my clinic. They were now able to get comprehensive care, access subspecialty care, more up-to-date medications. They are now in danger of losing that care and coming back to the care that we're able to provide at the free clinic. There's been some characterizations of people who were beneficiaries of Medicaid expansion that I just want to correct. I'm sure you've heard Speaker Johnson and Vice Vice President Vance referred to these Medicaid expansion beneficiaries as able-bodied young men living in their parents' basement playing video games. Nothing could be farther from the truth. I know these people. They are my patients. Um, Most Medicaid expansion beneficiaries are employed, or they're caretakers, or they're attending school, or they suffer from an illness or disability. Now, 79,000 Mecklenburg residents are at risk of losing Medicaid that they just got through Medicaid expansion. One last clarification, since we're talking about uh, the truth here. Non-legal immigrants do not qualify for Medicaid or ACA insurance. What is true is that the One Big Beautiful Bill Act will remove Medicaid access for several legal immigrant groups, including those with temporary protected status, refugees, asylum seekers, victims of human trafficking. One last thing. You may have heard the vice president talk about illegal immigrants in emergency rooms. Emergency care of immigrants or anyone without regard to insurance or ability to pay is mandated under a Reagan era law, the Emergency Medical Treatment and Labor Act, that requires emergency treatment of anyone who shows up in the ER. I can tell you, when we're working in the ER and somebody shows up, uh, you know, bleeding or at acute risk, we don't check their papers before we treat them. We treat them to save lives. And so, fortunately, we're not checking the legal status of people before we save their life in the emergency room. Well, what about the ACA tax credits? The ACA was signed into law in 2010 and expanded health care to millions of uninsured Americans. It eliminated denials due to pre-existing conditions. I talked about expanding Medicaid, and then it created this commercial insurance marketplace where people could buy insurance. Typically, these folks were self-employed, or they were gig workers, small business owners, farmers, ranchers. People who worked for small companies who weren't able to offer health care. And they were often folks with low income who made too much to qualify for Medicaid. But the premiums for those commercial insurance plans that I mentioned could be expensive. If you get employer sponsored insurance, as a lot of us have in America, there's a cost sharing with your employer. But in the marketplace, the burden's all on the individual. So fortunately, the original marketplace insurance came with premium subsidies or premium tax credits. And then those subsidies or tax credits were expanded or enhanced, largely due to COVID from 2021 to 2022 by the American Rescue Plan. And then they were further extended from 2023 to the end of this year with the Inflation Reduction Act. They have allowed low income persons to have often zero premiums and middle income persons to have premiums that were capped as a percentage of their income. There used to be this cliff that people would fall off as they got to a certain income where they weren't eligible for premium tax credits anymore, and premiums would soar. And that was capped as part of this enhanced premium tax credits. Needless to say, very popular and highly effective in allowing people to get health insurance. If you want people to have health insurance and be healthy and live long lives, this helped. In fact, the percentage of uninsured Americans hit a low of 8% in 2023. There's now 24 million people enrolled in marketplace plans. Most of them have enhanced subsidies. That's up from 11 million before the enhanced subsidies were introduced. So Dr. Adams went over some of the statistics of how the cost of ACA insurance is going to go up. I'll just repeat a couple of those. If you earn $28,000 a year, you pay right now with the enhanced tax credits, you pay about 1% of that, $280 in premiums for a plan. Now, when the tax credits expire, you're going to be paying $1,500 or 6% of your income for health insurance. And on average, premiums are expected to go up about 114% from $900 to $1,900. Middle income families are going to really be hit hard. So if you have a 60-year-old couple who earns about $85,000 a year, they'll see a premium increase of $22,000 a year. That'll be a quarter of their income. That's unsustainable. So, what happens when people are faced with unaffordable premiums, particularly younger people, healthier? They're going to drop their health insurance. That shifts the remaining risk pool in that insurance plan to sicker individuals, and that's going to be more costly care. So marketplace insurers, commercial health insurers, are going to raise their premiums because they're going to have a sicker healthcare pool, and it's expected those premiums will go up 18%. So, as was said, open enrollment starts November 1st. I think it already started in Idaho uh, a week ago. People are already getting to take a sneak peek at the plans on Medicare.gov, and they're seeing these increased premiums. So Congress really can't delay. They don't have the luxury of discussing this for another month. It's really a ticking time bomb for healthcare in America. One last thing is uninsured people, of course, don't stop getting sick. They're going to continue to seek care. So a decrease in the insured population is going to cause a lot more financial stress on the healthcare system, particularly our vulnerable rural hospitals, which have been closing at an alarming rate. It's an estimated $32 billion is going to be lost in payments to hospitals, providers, and physicians, and uncompensated care will increase by almost $8 billion in 2026. I'm going to take a last minute and I just want to zoom out and look at the situation I just described in the overall context of our American healthcare system. You really have to ask yourself why. Why in the world, in the wealthiest nation on earth, do we have a patchwork healthcare system that's so fragmented that folks are left vulnerable to losing healthcare if they're denied a subsidy that helps them pay for the excessive insurance cost? And worse than that, if you lose your job, if you lose your subsidy, you lose your health care. But for many Americans, if you lose your job, you lose your health care. Even worse, you better not accumulate too much medical debt or you'll lose your good credit rating, and you might even lose your home. All this is to say that our system is expensive, complicated, dysfunctional. We are unique among wealthy nations, and we don't have universal health care despite paying twice as much per person, and we have terrible outcomes, including maternal mortality, infant mortality, life expectancy. All those statistics are worse for people of color. Now, if Congress doesn't act quickly, we're going to add another 4 or 5 million people to the 27 million already uninsured in the United States. And it's not hyperbole to say that a lack of health insurance can result in death. A recent study showed that an estimated 45,000 of us die each year due to lack of health insurance. So that number is going to increase. For me, the answer is clear. We need to extend the premium tax credits immediately and then work toward universal health care in America that's going to provide guaranteed, stable, quality health care for everybody so we never have to be in this terrible predicament again. Thank you.
Thank you so much, Dr. Robinson. If you are just joining us, we will also be holding a Q&A session after hearing from our panelists. So if you have a question, please submit it through the Q&A box at the bottom of your screen. Next up, we have Dr. Charlene Green. Dr. Green is a board-certified anesthesiologist in Greensboro and former president of the Old North State Medical Society. Dr. Green, I turn it over to you.
Yes, I have to apologize for the noise in the background. I'm at my daughter's volleyball tournament, and I'm in the YMCA, so please excuse the noise in the background. Hopefully you guys can hear. I just want to make a comment that, patients going from insured to uninsured it's really a big problem. And I'm going to talk about I'm sorry for the noise. Are you all able to hear me? Okay, awesome. So I'm going to talk about the things that I have seen in my profession. Behind each number is a person. Someone who's has diabetes, who's not getting their insulin, they can die. They can get amputations. They can have serious diabetic ketoacidosis and coming into the emergency room. And it's just caused so much morbidity and death. A heart patient who skips their medications, many times they can not be able to get to the hospital in time enough for bypass surgeries and stents to save their lives. A pregnant woman who doesn't receive prenatal care increases the morbidity and mortality for not only herself, but her child. Without coverage, people stop taking their blood pressure medicine. They stop taking everything, and so they can increase their heart attacks and have more strokes as well. I wanted to just give you a story about a personal story of like what I would see every day before I retired. Firsthand, when women would come in for what we consider now ectopic pregnancies, is excruciatingly painful. where an embryo would be growing in the fallopian tubes of a woman's body, and it's absolutely an unviable pregnancy. That was in the past. Now it's considered a delayed case, because many times, in the past, it would be considered an emergency case. Now, many physicians have to wait a minute to get ethical considerations at times, and just are scared themselves that they may have some ramifications that are legal. And that is new in the last few years because of just the extreme issues with healthcare, and some of the laws that have been really anti-women. So therefore, if a woman's fallopian tube ruptures with an ectopic pregnancy, that can cause death, severe bleeding, and affect a woman's ability to bear children in the future. That's what we're seeing now, particularly with, in this healthcare system. But more importantly, when women cannot get the healthcare that they need, they stay at home or in their cars, and this is causing severe problems. I mean, it's only going to get worse when we have more uninsured patients. These delays in evaluating cases increases morbidity and death. And I'll give you an example of that. So what I saw even before we had Medicaid expansion in North Carolina, when there were uninsured patients, we would see patients that would not be able to afford getting a CAT scan for thyroid masses, or maybe some major issues in their back or any other problems in their body. Because they weren't able to afford even the basic things such as preventative care, you would see maybe 3 or 4 years of delayed care. So when they came in, they had increased morbidity and increased incidences of death because they're complications of the surgery and the extreme issues of being able to take care of these patients. When people lose insurance, they don't stop getting sick. They just delay their conditions and become more critical at that point. So physicians are many times facing impossible ethical dilemmas where they're providing care that they know they can't afford. And so therefore they won't come in to get care. We're also seeing more patients that suffer because they can't get the treatment. I want to just make it clear that what we're seeing in the hospitals too is the denial of NIH innovation for the future. A long time ago, when I was doing my training at Duke, laparoscopic surgery was not as prominent as it is today. We had most cases were done open, meaning that you had to do the surgeries that way. Now most surgeries are done laparoscopically, gallbladder surgeries and gynecological surgeries, and even a lot of other surgeries that most people consider just routine, like appendix surgery. That was the research back in 1970s and 80s that helped outside of the that tried to that the innovation that helped with the innovations that tried to help what we see today. So now with the NIH cuts that we see, it's going to affect the innovations that we see in the future in the next 25 years, and may delay some of the outstanding innovations that are needed to save our lives in the future. I'm going to stop right there and leave it for questions at the end just because of the noise. But I just want to thank Dr. Adams, Congresswoman Adams, for being focusing on these issues, because it's really, really important.
Thank you so much, Dr. Green. Next up, we'll turn it over to Dr. Holliday. Dr. Holliday is a doctor of pharmacy and a CPHQ with the C.W. Williams Community Health Center in Charlotte, which has proudly provided affordable, accessible healthcare to our community for more than 40 years. Dr. Holliday?
Good evening, everyone. Thank you all so much for having us join. And thank you, of course, to our wonderful Congresswoman, Dr. Adams, who always puts healthcare and our patients and her constituents at the forefront of our minds, and make sure that those that we're serving are not forgotten. As a member of an FQHC, or federally qualified health center, we have lived the legacy of providing care to our community regardless of their ability to pay. That is our mantra. So we're the cousins of our rural health centers and free clinics, with a little bit more funding, as Dr. Robinson spoke to earlier. But the problems that we face are the same, because we are in the community, we're serving the community, and we see the patients and the faces of the outcomes of what we're facing and what we're seeing happen on the back end. And what I mean by that is every action has a reaction, and every action that is taking place, every law that's going forth that is touching the community is touching the patients that we see every day coming through our doors. And so the Congresswoman spoke earlier about inequality in healthcare. This is not a new problem, but it's definitely become worse. Every day we are serving patients that have to make the choice between whether they are purchasing medications or putting foods on their table, whether they're paying a utility bill or whether they're coming to see the doctor. And what that results in, of course, is the more complex patients, those who are more sick, not coming to receive care until their sickness, their disease state has progressed to a point where they need extensive care. And so often you have, as an example, I'll call a patient Mr. Johnson. You'll have a Mr. Johnson that hasn't seen a provider in 10 years, right? And he ends up seeing Dr. Robinson, or he comes into my health center for care. And at this point, his disease state has progressed so far that there's so many things that needs to happen. There's so many medications that he needs to have. There's so many screenings and there's so many scans that he needs, as Dr. Green talked about, that he can't afford because he doesn't have insurance. Fast forward to having these Medicaid expansion plans, and now Mr. Johnson has Medicaid. And for the first time in his life, he has access to quality and affordable health care. And so he understands now that he can come in and he can get his medication. He understands that he can come and see his doctor, that the medications he's been prescribed, he knows how to take them. He understands that he has longevity in his life. He understands the quality of care and of life that he needs to have. But what happens when all that comes away or goes away? So starting in 2025, we've seen a progression of issues that impact our patients that are making it unsafe for them to have healthcare. And what I mean by that, it starts at the beginning of the year. We have patients who are fearful of coming to receive healthcare because of threats to them. And so they feel uncomfortable maybe to come into a health center. We're no longer deemed a safe space any longer. And so we have individuals who no longer come to pick up medications. They no longer come to see their doctor because of fear of what is happening in the environment and of their status and whether they can be seen or not. You have patients who have already begun to lose Medicaid access in North Carolina due to the effects of the one big beautiful bill, or ugly bill, as our Congresswoman says. And because of that, you already have patients who do not have access to medications, life-saving medications that have already, those changes have taken impact and affected their lives, their everyday life. In also the beginning of October, starting with all of the additional changes that occurred, we have patients that have not only lost access to their Medicaid, but are already struggling. They're wondering what happens to some of their benefits and their food benefits. The Congresswoman often talks about food and our ability to make sure that our community has access to affordable food. The west side of Charlotte, where one of our health centers is located, is in a food desert. And so when you start taking away healthcare, you have to look at all of the other pieces that play into this. We're looking at not having healthcare. We're looking at now having affordable food options. And so how am I going to have a healthy America when my patients don't have access to healthy fruits and vegetables? How am I going to have a healthy America when my patients don't have access to their medications that they need? How can I have a healthy America when, the cost of affordable living, affordable housing, they're concerned about everything that we call a social determinant of health. And these are the pieces that every day impact our patients' ability and create a barrier for our patients to receive the care that they deserve. We work in an environment where the community is really transparent about what's happening to them. And so we can see pretty clearly what's happening already and what will continue to happen with the potential loss of these subsidies, and realizing and understanding that patients will not be able to maintain that coverage, and understanding what will happen Mr. Wharton also talks about, and he'll talk about this as well, about making people employable. But now we have all these other issues. How can we have a healthy job? How can we have a healthy body, a healthy spirit, a healthy mind, if we are not having the things that are right, which is our health care? And so as we look through every piece of what we're doing, what comes next, what we've dealt with, we know that our patients are already crying out for help. Our community is crying out for help. And without changes that are being made, what happens to them? What are the next steps? What are they dealing with every day? We are sentencing people to death every day by taking away their right to health care. And that's something that really should resonate with all of us. We can't take for granted that we can call our doctor or we can go to a doctor's appointment, because that is not the reality of a lot of our patient population, especially with the changes that are coming down the pipeline right now. Even with the current government shutdown, the facilities that now support those patient populations are also at risk. So your health center sees approximately 34 million patients every year. And that's not even counting our rural health and our free clinics. And so 1 in 10 of your Americans are seen at a federally qualified health center, because we serve those who are underserved and underrepresented. Well, what happens when your federally qualified health centers don't receive funding? What happens when the little support that your rural health centers or your free clinics have, they no longer receive that support? Well, now that sickness, that disease, those patients that are fighting for their lives, they're on the doorsteps of those who could care less to take care of them. And so when we look at everything that happens, we have health centers that are closing, we have clinics that are closing, we have rural hospitals that are closing. And so as we create more of an issue, we're also taking away those that can solve the issue. And so there's so much more work for us to do, but it's really up to us to understand the long lasting impacts of the choices that are made today. We will be cleaning up these errors and issues for years to come, because there's so many patients, and there's so many of our constituents, of the Congresswoman's constituents, of our community members that are still fighting for their lives. They're fighting for the freedom of healthcare. They're fighting to live, because their populations are being impacted every day. And so I challenge you all to, look beyond the smokescreen and actually see the true issues at hand and see what is at stake and what is at risk. And it is our freedom. It's a portion of our freedom. It's what we're fighting for every day, is the ability to live and the ability of our patients and our community members to live as well. Thank you.
Thank you so much, Dr. Holliday. That was absolutely incredible testimony. Uh, and finally, to close out the panel portion, we have Mr. Nick Wharton. Mr. Wharton is the President and Chief Executive Officer of the Charlotte Area Fund, Mecklenburg County's Community Action Agency. Mr. Wharton also serves on the Community Advisory Board for the Atrium Health Wake Forest Baptist Comprehensive Cancer Center. Mr. Wharton, I'll turn it over to you.
Thank you so much. Let me first say to the Honorable Congresswoman Alma S, thank you so much for always understanding and seeing and being insightful around the relationship between the social determinants of health and poverty. And your bipartisan leadership and continue to support the Community Service Block Grant, which supports 1,000 community action agencies across the country, 11 million low-income families. Thank you. Thank you so much for including me with this group of distinguished medical professionals. This is an honor. So let me just start by saying that, we're in a historical period and a hysterical period. And some have said, we're fighting for the soul of America. In many cases, this is a strategic inflection point. So when I think about the work that we do with the Charlotte Area Fund, as stated, we're in Mecklenburg County's Community Action Agency. We are connected to 33 community action agencies in North Carolina, 1,000 across the country. We work to help invest in human capital, to help low wealth individuals to reach economic self-sufficiency. Our clients are at 125% of federal poverty and below. So we really are talking about those who are on the margins. So all of the conversation that has occurred here, these are profound impacts on the least of these. And so the stories that you heard this evening, about the impacts of these cuts on folk. It is a traumatic and traumatizing experience for low-income families. And I come to this, as the Honorable Congresswoman said, it's personal for me. I grew up poor in New York City, in a poor working class community, and I witnessed my mother die prematurely from lung cancer, as well as my wife's mother died also prematurely from a cancer that, quite frankly, if the research and resources were there, they might be living with us today. And so, as was stated, I'm on the Cancer Advisory Board with Africa Health Wake Forest Baptist, and I'm looking at the almost over $1 billion of cuts to NIH that's going to undermine the important research that's going to set us back years, immeasurably in years. So when I think about the Charlotte Area Fund, and I think about the work we do in North Carolina, there are 57,000 clients we serve across the 33 community action agencies. They also support Head Start programs. At least 22 of those agencies support Head Start agencies. And they work with young folk at the dawning of their age. They also work with senior programs. They also have low-income heating assistance programs. And we're going into the winter months. And that program provides needed financial support, right, to supplement heating bills. Very, very important. Weatherization programs, right, that help repair homes and get them fit to really provide the comfort and it really focuses on social terms of health. So the community action agencies across the country are almost a connected tissue that supports all those programs. $800 million budget for community action agencies are at risk. Already in the Office of Community Service, these 4,000 federal employees have been cut. A significant portion, 17 at least, in community services offices that oversee these programs are at risk. We're very concerned about what the future of these programs are going to be, but it's all very much connected to the work that we're talking about this evening. So when we talk about cuts to federal health care programs like Medicaid, ACS, they mean fewer resources for preventive care, chronic disease management, mental health services, and these are CSBG clients, community service block grant clients. When I think about COVID, the period we came through, 1 million American souls were lost. Many have had pre-existing illnesses, uninsured, underinsured. Some of those individuals could have been with us today. And quite frankly, many scientists suggest there's another pandemic on the horizon. So are we prepared, quite frankly, right? The least of these, are we prepared to challenge that? So when we go through, we look at increased demand for the work that we do. As I think about the cuts, what's going to happen, for us, we think about we'll have less opportunities to make medical referrals. We do transportations to appointments. That will be impacted. Certainly, we provide emergency assistance. That will be impacted. Those CSBG agencies will be constrained to do the things that they need to do, right? And so when we think about the millions of Americans who lose access to coordinated services, like navigating healthcare systems and achieving economic stability, clinics in rural areas we mentioned. Many of the community action agencies are in rural areas who are already strained and they're really the core support systems. Many of these individuals are really the epicenter of all the human services in these areas. They operate in obscurity. Many of you don't know who they are, but they are working very diligent and they will be impacted too. So quite frankly, I don't want to restate all that's been said, but when I think about the clients that come to us, they're already living on the margins. They're already living on the margins. Our task in many ways is to help upskill them, get them prepared, help them to reach economic self-sufficiency. And all of this continues to strain and pull down. And it really, I'm concerned about the next future generation, and we all should be. The level of cruelty, quite frankly, the level of insensitivity, we should all be quite concerned about. So I'm glad to be on this call. This is an incredible group. I'm really excited about the questions we might be able to respond to. Thank you so much.
Thank you so much, Mr. Wharton. And thank you to all of our panelists for joining us today. Now we have time for a Q&A session where we'll answer some of the many questions from our attendees. And as a reminder, if you have a question, please submit it in the Q&A box at the bottom of your screen. Our first question is, why is dental care not covered by traditional healthcare? And why is preventative care less likely to be covered?
Well, I'll take it. I'll answer the second part first. As you look at things that are wrong with the America, and to be clear, there are so many things that are right with healthcare in America. We lead the world in disease treatments and cancer treatment, things like that. But medical education is terribly expensive. So that results in not a lot of people going into primary care. So there are too few primary care physicians available, and the way we are focused in the United States on treating disease rather than preventing it. Um, and frankly, some of that's due to the costliness of our American healthcare system. I think we need more primary care physicians. We need to be more focused on disease prevention rather than treatment, as so many other countries are, wealthy countries around the world that provide universal health care. The dental piece, I think dental, vision, and hearing should be part of any health insurance program. And if we're talking about universal health care, I think that would be a no-brainer to have those as part of universal health care.
Let me just comment just on the clinical part of you. Even before these cuts, my 30 years experience as an anesthesiologist, it was catastrophic to see the amount of people with minor dental issues that came in with abscesses. And what people don't really understand is that there are people that when you cannot take care of dental issues such as an abscess or minor issues, they continue on. So, and that when you have a dental abscess, you are affecting your heart many times. So I would say before I retired a couple of years ago, I would say once or twice a week, I would get dental case issues where you now would have someone needing severe heart surgery, such as tricuspid regurgitation issues and major bypass surgeries. And many times they didn't survive. So with the issues of now many more patients being uninsured, now we're going to see people who not only can't afford medical insurance, but the money they did have before when they had insurance, was able to do minor cases or preventive care for dental work. Now they're not even going to be doing that. So I think it's going to be catastrophic problems.
Let me just add that, dental care, like all aspects of healthcare, health insurance should be covered by your health insurance, which is why it's so important for us to protect the healthcare programs like Medicaid and ACA, because they do have that provision that will enable people to get that. But dental health is a real important part of your overall physical health, as Dr. Green has said. You can have a problem in your mouth, and that just creates a whole problem for your whole body. So, there's some people, I don't know, I kind of grew up a little bit fearful of dentists, but now I'm more comfortable and I go, and I've had a number of things done, but I still have my original teeth, a lot of them, most of them. But I do think that we have to really think about this. It's about educating, I think, making sure people understand why it's important. Preventive care, go get your dental checkups and your cleanings and all those things will prevent you from having problems later. I'm not a medical doctor, but just my own personal experience from that, I can tell you that dental health is very important.
Thank you. Our next question is, why are the Republican representatives defending Medicaid cuts when they know how it will affect the American people?
Well, I guess that's a question for me, but let me, I really can't speak to why my Republican colleagues are defending Medicaid cuts, but I can say that that's nothing new. When you think about what happened in the 1980s, the Republican administration, starting with Reagan, often proposed limiting federal spending on Medicaid. We have seen since I've been in Congress the past 15 years, and I haven't been there 15 years, but I will say that within the past 15 years, Republicans have repeatedly tried to repeal and roll back the Medicaid expansion. And so these are just little tricks that are being played. I mean, if you think about some of the other things that have happened when we say we're going to, and I'm going to just mention this about education, we're going to get rid of the Department of Education. Well, that's something that the Congress will have to vote on. But if you eliminate all of the people, you reduce the staff so that you know what you do while you still have the building there, the title on the building, you can't really do the work because you don't have the people, so they find a way. And so, in my opinion, this is just a backdoor way of getting rid of the Affordable Care Act. I'm certainly trying to do it because it's not for the time period that I've been in Congress. There have been at least 8 or 9 attempts to just get rid of it. But then, yet there is no proposal for what else is going to happen to help people in terms of health care. But so that's why we need to continue. That's why I would say that we need to continue to call, to text, whatever you do, whatever it takes. And I can tell you, they may not answer the phone, but your messages are being recorded.
Thank you, Congresswoman. Another question we have, and this will be open to anybody, is if we lose state and federal support for healthcare, what other community resource exists to take care of our health? And Dr. Holliday, I feel like y'all might have a very good response to this.
Absolutely. So, a not so shameless plug for FQHCs, but federally qualified health centers are designed and were organized precisely to take care of our community. And we will do that. We have been doing that for 60 plus years. C.W. Williams Community Health Center in particular celebrated our 45th anniversary this year of taking care of the community. We understand, and when I say we, I'm talking about health centers in general, understand the weight of this as well, because there is not a huge ton of money that we receive just to take care of people, or we find a joy in taking care of those who are uninsured. We have insured patient populations to help offset the cost of those who are uninsured, and to make sure that we can continue to serve those who don't have, are unhoused, and those that don't have. But to answer your question, your health centers are one area. You have free clinics that are your other, and your rural health centers as well, that are in the community. But to bring the point home is that the funding for these facilities as well are also being targeted right now. And so you have health centers and clinics that are not receiving their funding right now, and they don't know what that funding looks like because they're not it's not stable funding from year to year. And so, the work continues. There will always be someone in the community that can take care of the community. Now, the reality of that, are there enough of people in the community to take care of all of those who need the services today? No. And so as we continue to lose coverage, as we continue to roll back Medicaid and roll back subsidies and ultimately have our community lose their ACA, what's going to happen is you are going to have an even greater need in the community, and your community health centers, your rural clinics will try to take care of as many patients as possible. But the reality is there will be some areas where things fall short just from the sheer numbers that we anticipate that will need services.
Yeah, let me just say that community health centers are really essential to our health care, to particularly our most vulnerable citizens. And so that's one of the reasons why I'm very supportive of C.W. Williams and all the organizations in that space that do the work for those individuals. And that's why having citizens get involved and stay involved in this political process is so important. Because somebody's going to make a decision for and about you most times without you. And sometimes those decisions are not the best ones. So that's why it's important for our citizens at large to be engaged and to let public officials, particularly members of Congress right now, know how important healthcare is to you. And so we know that our citizens basically rely on the support the state and federal healthcare programs. And if you think about what's going to be happening The state will not have the funds available. They're going to be pressed to do so many other things as well. So federal government needs to step up and continue to do what we've always tried to do and support these our community health centers, because you pick up the slack. And so what's going to happen, I see, like I said, I was over at the hospital today, and there was so many people in the emergency room. And so, and I suspect many of them did not have health insurance, and that's why they were there. And so that's going to spill over. And then if anybody feels they're not going to be touched, let me just say that means that if you got health insurance at all, it's gonna increase. The premiums are going to increase for everyone. And so we've got to make sure that we stay on top of this and make sure that we protect everyone, because it is a basic right as far as I'm concerned. It is a basic right. Everybody needs health. This is not a partisan issue. And I keep saying, if you're in pain, you need to see a doctor. You can't, that pain is never described as a Republican pain or Democrat pain or pain of no party affiliation. So we need to stop that and make sure that we take care of people. And I tell you, I appreciate my colleague Marjorie Green for at least coming out, standing up and speaking up, even against her party. I mean, you got to do the right thing because it's the right thing to do. This is the right thing to do to make sure that we have health care that is affordable. To have access to it, and you can't afford it, you don't have access. I mean, just that's bottom line, plain and simple. That's exactly what it is. And if the Lord blesses you to live long enough, and sometimes, you don't have to be old to get sick. I mean, I saw some kids in the hospital today. So, but anyway, I listen, thank you so much. Is there another question, I think, before we have to
Congresswoman
get out of
Adams,
here?
I just want to mention that the FQHCs and the free health clinics actually do amazing work and save many thousands of lives in North Carolina and around the country. I just want to reemphasize that when you close rural hospitals, sometimes minutes matter for people when they need actual health care, such as heart attacks, heart surgery. When I did trauma surgery, which was most of my life for the last 30 years, sometimes we would have patients that would need only 5 minutes before they died. So they would come up straight from the emergency room to the operating room and need to get the surgery. That could be heart surgery, that could be ectopic pregnancies, that could be strokes and things like that. So when you're now also closing rural hospitals and it takes an hour or sometimes to get to these other hospitals, these patients, not only are they going to have preventable deaths, they're going to have catastrophic, just horrible deaths. And I just think that that is really, really important. The last thing I want to mention is that what we don't talk about too is the work that Congresswoman Adams and former President Biden did with the administration with the Inflation Reduction Act and American Rescue Plan, is helping to decrease medication costs. So there were 3 particular drugs I'm going to talk about: Coumadin, Plavix, and Eliquis. So when I keep talking about heart disease being like sometimes the #1 cause of death in many patients. So when a patient can't get their Eliquis, can't get their Coumadin, which are blood thinning medications that can thin your blood out so that you don't get a heart attack, don't get stroke. When you can't afford those medications, which most of the patients, even before these bills were passed, they couldn't afford them. So now they can't afford them at all. So they can't get them, and they will have more and more deaths.
Wow. Thank you, Dr. Green. And you're right about the rural hospitals. We have hospitals right now that are closing. And, okay, so there are jobs lost, but there are going to be lives lost because people are not going to be able to get the care. They're going to have to go miles and miles. And time may be of the essence. And so I just, again, we're going to have to continue to try to raise the conscious of members of Congress so that they understand while they may have good health care, so many people don't have it, but we all need it.
Congresswoman Adams, can I make a final
Sure.
point, if that's okay?
Yeah, sure.
So I realize that there are multiple impacts that the American people are dealing with. And there's a profound breach in this social contract that we always thought sort of existed that we could hang on to. I want to just emphasize that we don't sort of get into this learned helplessness sort of mode, right? Because it sort of drains you of your positive energy. There's so many dynamics sort of happening that it just colors your view of what's possible. So I remember, I'm aware of the period in which that created community action agencies,
I do.
right? And so it was a clear reality that both the government and the market had failed poor people, right? So the level of engagement, right? We have to sort of re-envision, if you will, right? But it's very easy to become despondent,
Yeah.
and particularly for some young people I talk to, they're incredibly despondent, and they're kind of tuning off to whatever this looks like, right? We have to sort of stay engaged.
Oh, yeah.
We have to keep sort of hope alive, if you will, but we have to, hope is nothing without action. And so
Yeah.
we have to do things. Doing nothing is not an option.
All right. I agree. Yeah, thank you so much, my brother. Yes, ma'am.
I was gonna say, Congresswoman Adams has always exhibited excellence in everything she's done. So I just want to make a comment just to add on to what you're saying. Excellence beats mediocrity every day, but excellence demands courage. And Congresswoman Adams has had courage the whole time that she's been in office that's why we're here now, spreading this message, because we cannot give up, and she's not giving up. And I know she's gonna do everything she can to make this happen where we can get what we need done.
Thank you, Dr. Green. Thank you all. Thank you, Dr. Robinson, excuse me. Thank you, Dr. Robinson. Thank you, Dr. Holliday. Thank you, Dr. Wharton. We'll give him elevate you. Thank you to my staff and to all the citizens who tuned in tonight. Thank you so very much. Listen, we're going to keep pushing. We're not going to give up. We're going to continue to work hard to ensure that everyone is treated fairly. And if you don't have health care, and if you don't have a way to get affordable health care, then you're not being treated fairly. And so just know I'm going to stay on it, and I'm going to stay with it. I appreciate all of you joining us this evening.
Perfect. Thank you so much, Congresswoman, and we'll close it out there. Thank you to everybody who attended. And if you need anything at all from our office, like Congresswoman Adams said, you can reach Congresswoman Adams' Charlotte office at 704-344-9950 or her Washington, D.C. office at 202-225-1510. Thank you all so much.
You all have a good evening.